Morning, everyone. It's 10 o'clock now. Just before we start, just to remind you that the meeting is going to be recorded. And so that recording has just started. Thank you. So welcome to the NHS Grampian Board meeting for March 2024. First on the agenda is apologies. Leslie, can you remind us of any apologies, please?
Yes, we've got apologies from Professor Bhattacharya, Albert Donald, Joyce Duncan and Dennis Robertson.
Thank you very much for that, Leslie. Thank you. Can I ask board members if they have any declarations of interest, please? No, I can't see any. Thank you. So we'll start with a few words from me to start with. We have two updates on the papers today referring to capital investments. Firstly, an update in the Chief Executive report on the National Treatment Centre and on Dr. Gray's MRI. And secondly, a substantive agenda item sharing progress on the Baird Family Hospital and Anchor Centre. I would like to reflect here on another capital project that is well underway, but not spoken about quite so much, the new mortuary facility for the North East and Northern Isles. As anyone who has visited the Forester Hill Health Campus in recent weeks will have seen, the construction of the integrated mortuary is progressing very well. Once completed, this £30 million building will provide greater privacy and dignity for the deceased and bereaved families, as well as creating modern teaching, learning and training facilities. It will also have a net zero carbon heating strategy in keeping with NHS Grampian's sustainability aims. 2024 has seen the building really start to take shape. Indeed, it is increasingly visible from multiple points across the Forester Hill campus. And procurement of essential equipment for use within the mortuary is also now well underway, along with the planning for the commissioning and training phases required for it to enter operation. I think it is worth reminding ourselves that undertaking these huge construction projects on a busy working health campus is extremely challenging, and I would like to recognise the efforts of both the project team and our partner organisations that go into delivering them. And thank you also to all the staff, patients and visitors for accommodating any disruption during the construction phase. I would also like to mention briefly the Blueprint for Good Governance item on today's agenda. In an extremely busy and complex system like ours, the leadership and focus we as a board are able to bring to bear on transformation will be crucial in achieving the sustainable delivery and quality of services and patient care we are able to provide in the future. It is therefore good to see a strong focus on innovation is proposed alongside the board's assurance role to support progress towards our plan for the future. Finally, it would be remiss of me not to mention the challenging financial landscape we find ourselves in. Whilst our final position for the current financial year and medium-term financial plan looking ahead are currently being completed and will come to next month's board meeting, funding capacity or lack of it is reflected among some of today's papers. I would therefore like to reiterate that financial prudence remain key for board members when we are scrutinising performance and decision making. However, this will always be considered in balance alongside good clinical governance and appropriate staff governance, as well as the prevention agenda. Thank you for listening to that. Thank you very much. We'll move on with the agenda now, and the first item is the minutes of the meeting on the 7th of December. Can we first of all accept those as a true record of the meeting, please, board members? Thank you. I see nods there. Thank you very much. Thank you. We'll move on then to item 5, which is the Chief Executive's report, and I'll hand over to Adam Coldwells for this report, which is for us for noting. Thank you.
Thank you very much, Chair, and good morning to everyone. A few items just to make sure everyone's aware of and to place here in our public board meeting so that everyone's aware of them. The first one relates to the inspection by Health Improvement Scotland, HIS, as we know them, who visited both ARI and Dr. Gray's in October of last year. I think worthy of note is the inspectors praised many things about the staff and the sites and things that we do, and the incredible work that our staff do under a number of pressures. That said, there were a number of things that we needed to look at to improve, and I'm sure the board will be pleased to know that the action plan is progressing very well, with a good number of measures already implemented and taken forward, and a further number that we're working on and taking forward, and that we will do our next submission to HIS in June in the summer, with progress and completion of many more of those actions. There is a separate requirement around the management of controlled drugs at Dr. Gray's, and we will be giving HIS an update report at the end of this month, and that's all but ready as we meet today. Moving on, the financial position, and the chair mentioned this in passing in her introductory remarks. We have really good progress on our financial plan for next financial year, the 24-25 financial year, but I absolutely need to say that our forecasts are extremely challenging, and we're working on a savings plan that's in excess of £77 million, so a really substantial sum of money. I think for context, that the scale of this challenge is absolutely unprecedented, and we simply cannot underestimate the challenge that we face in developing our medium-term plan. And as Alison said, but absolutely important to repeat it, we're doing this financial saving, balancing the three governance strands of clinical governance, staff governance and financial governance, whilst absolutely ensuring we continue to look forward, and we work really hard on the prevention agenda, so that we try to change the profile of the future of the need to treat disease. This is obviously coming to the board next month, and again the board are in lots of dialogue with us in the development of that plan, and so I'll look forward to bringing that to the board next month. The next item, number 3, that I wanted to mention was the national treatment, again about the cap funding and the announcement from government that we needed to cease the National Treatment Centre. This obviously has an impact on the building that was going to be called the National Treatment Centre, as well as the MRI hospital.
Sorry, Adam, can you just pause?
Yeah, sure.
I think someone's got a mic on, please. Can you make sure you've got your mic switched off, please?
Okay, thanks, Alison. Thank you. So, and this obviously has an impact on also the MRI at Dr. Gray's Hospital. I think all of us, without exception, huge disappointment for everyone, for the staff working on the project who had committed so much effort to that and developed a really great plan that was going to develop it. And obviously for the population that we serve. However, we have an absolute commitment to these things, and as the capital funding position changes for the country, we will obviously revisit those and pursue our commitment to these in the future. And certainly, we're not different to any other part of Scotland. This is a Scotland-wide challenge. I think the important bit just to note here is that we've got our capital allocation for this year, which is in a process at the moment to see how we're going to spend that limited money, thinking about all the risks that we face in backlog, as well as things like the Dr. Gray's Ward 4. And there's a process to go through that will conclude through our asset management group over the coming weeks, so that we get a conclusion of how we're going to commit that resource over the coming year as we go forward. The final thing that I wanted to speak about was the flow and safe transfer of patients. So the context of this is where we see it most visibly is it has been in the emergency department and some queuing ambulances outside emergency department. And I really just wanted to give some assurance to the board that we have lots and lots of activity ongoing to mitigate this as far as we can. There are some limitations, but to mitigate this as far as we can. And I've mentioned here the Flow Navigation Centre, the call before you convey, and they're two really super bits of work that are absolutely contributing positively to the position, as well as the safe transfer of patients work that has made some changes in the structure of what we do and put in place some different operating procedures of how we support patients to flow as effectively as we can through the system. This is, really key. I've also mentioned the additional beds that we've managed to put in place, and there's still a small bit of that to conclude over that initial phase 1A, if you remember how we described it to the board last year. The other bit I just want to mention, Alison, if that's okay, that apologies I didn't write it in the report, but I think it's really important, is we received recently what's called the Discovery Report, which is from the government improvement group who work really closely with us. And the Discovery Report was extremely positive about our efficiency of unscheduled care and highlighted some of the limitations that we have structurally in the system around capacity and things. So again, that's really helpful for us to absolutely recognise the great work that staff do, and also the limitations that then clearly we need to, as an executive team and a board, think about how we address those over the coming period of time. And there's no quick fixes there, but things that we've got in train, and we need to think about how we develop those against what's available to us, and clearly the very challenging financial position that we're in at the moment. So thanks very much, Alison. That's my report.
Thank you very much, Adam, for that really comprehensive report. Can I turn to board members and see if there's any questions or comments for you, please? Thank you, Derek.
Hi, thanks, Alison. It wasn't in the report, but given the financial situation, Adam was good enough to come up to the Moray IGB when the IGB was discussing finances. And I just wanted to say thanks, Adam. I think that was exceptionally important. Thank you.
Thank you very much for that comment, Derek. Very helpful. Thank you. Mark, please.
Thanks so much, Chair, and thanks, Adam. I suppose it would be remiss of me not to comment on the NTC aspect, that obviously that's going to have a big impact on planned care going forward. And we know we're in a tight financial situation. So I think from a clinical forum point of view, that was extremely disappointing, a bit of news. And obviously that comes from a national point of view. But I think we would like to see that commitment going forward. Obviously, a lot of work went into that. So that's just a comment more than anything else, obviously slightly out with our control, but certainly a comment we would have to put forward. So thanks very much.
Yeah, thank you, Mark. I think Adam's indicating he wants to comment on that.
If I could, thanks, Mark, for the comment, and thank you, Derek, for your comment. Mark, the project team, as they wound up, have done a really diligent bit of work to have all the plans ready so that we can pick them up as quickly as possible if and when the money comes back on stream. So it was just to assure people that it's not just kind of been left, it's been really diligently done so that a team in the future can pick that up to pursue it again. Thanks.
Thanks very much, Adam. Sandy, please.
Thanks, Chair. Just coming in on the back of Derek's comment regarding a very helpful workshop that we held in Fochabers recently in relation to trying to develop a recovery plan for the budget. And I suppose there was just a couple of things to say in relation to that, and thanks Adam for coming to that. But I suppose at the recent meeting of PAFIC, what came over very strongly was the enormous pressures on the system, and that we are not unique in that in Scotland. I think I would be remiss, Alan and Alec, if I didn't say that I think there has been historically an over-reliance on underspends, vacant posts, or non-recurring costs to try to balance a budget with all these pressures in mind. I was hugely impressed at the last meeting of PAFIC in relation to all the planned activities and the oversight arrangements that are now being put in place for the year ahead in order to address that. I think those sorts of arrangements will need to be business as usual throughout the whole year, and not just in response to a pressure at any given time. And the last thing I would just say, Chair, is that in relation to the meeting we had in Fochabers, what came over very strongly is we can't, as an IJB, for example, in one area, try to resolve the financial pressure, and as a health board try to do that. We need to do that together. So we need to make sure that plans right across the system are complementary to one another, and there are no unintended consequences of one part of the system trying to find solutions that could impact on another.
Thank you, Sandy. I think they're really important comments that impact all of us in our work as board members and the executive team as well. So thank you very much for those very helpful comments there. Thank you. John, please.
Thank you, Chair. Yeah, Sandy's taken the point I was going to make about the cross-system work. I think we've made steps on that already, but we need to get into that, thoroughly in the year ahead. But the signs are good. I've just come away from a meeting from Aberdeenshire IJB, and that was right front and centre, the commitment to work together on that. Just a quick question, Adam, on the first point, the HIS reports, that's really helpful. Will the completion of that go through one of our committees, clinical governance perhaps, or back here, just to be assured on that, please?
Thank you, Adam.
Yes, I think it's lined up for clinical governance. I'll just check with June for a nod. Yes, it is definitely. So it's definitely coming through a committee, and clinical governance is the right place. Thank you.
Thank you very much. Thank you. Paul, please.
Thank you, Chair. In response to or supporting Mark's comment, I think it's worth saying that as we became aware at an early stage of the evolving and unwrapping frame for finance, we have been very proactively working with not only Scottish Government but also other regional health boards where there are existing national treatment centres. And one of the things that we're very much focusing on as an interim, whilst our NTC is part, is realigning and reallocation of their capacity to help. And I think it's fair to say that not only have Scottish Government been very supportive, but I think the chief execs of these health boards have been very supportive, to the extent that we now have essentially 50% recurring capacity at the Stracathro Regional Treatment Centre, which is being considered more and more as a national treatment centre. And we're actively looking at using a greater percentage of the Golden Jubilee National Treatment Centre, and also had very favourable conversations with NHS Highland with their treatment centre. So as a measure to control the delay in our own treatment centre, I think others are stepping in, which is very nice to be able to report. Thank you.
Thank you very much, Paul. That was really helpful. Thank you. Mark, does that give reassurance to you as well in the comment?
Yes, thanks very much. And actually, I back Paul on this, on the use of Stracathro. It's an excellent facility, and we've had really good response with that. I love going down there myself. I operate down there, and I think Grampian really is a real asset to us. So thanks very much for that, Paul.
Thank you. Sandy, are you coming back in, or is that legacy? I presume it's legacy. Thank you. It's gone down. Thank you. And I think it was interesting that there was a theme in those questions and comments that were made there around working on whole system, collaboration, partnership with people across Grampian and organisations across Grampian. I think that's becoming increasingly part of our work. And then the theme at the end as well about collaboration and working more with other health boards in the area to maximise patient care as well in what we're doing. So I think there was a theme in those remarks. Thank you. Thank you for that. I can't see any other comments, questions. Thank you very much. So that paper, that report from Adam was for noting. So I think we've noted it between us. So thank you very much for that. Got an answer there for that as well. Thank you. So we'll turn now to item 6 on the agenda, which is the How Are We Doing performance report. And I'll turn to Alex Stephen, please, to take us through this. Thank you, Alex.
Thank you, Chair. Yep. In this report, we've tried to give you a selection of greens, reds and ambers for the spotlights, and that was something that was picked up in the last minutes. So we are trying to give that kind of whole system view of our performance. We discussed the How Are We Doing report at our Chief Executive team, and we felt that the number of red indicators was a symptom of the operational pressure that we're currently facing in what is our busiest time of the year. So in future years, when we're looking at this report, we will be considering carefully what our targets look like and the profile of our targets over the whole year to take account of some of those busy spots. Within the report itself, we provided a short update on page 31 of all the red indicators. So if a red indicator hasn't been spotlighted, we have given a little bit more information on that. And we've also demonstrated where this has been reported to a committee or to a board. And for those that haven't been reported because they've recently changed to red, then our intention is to take an update on those to the next PAFIT committee. In relation to the report itself, I'd just like to highlight a transposition error in relation to page 25, and it's in relation to the indicator on mandatory training performance. And I'll just read out that change. So for Q1 for mandatory training, the figure should be 65% and 63% for other. For Q2, it should be 65% for new and 64% for other. Though that change does not impact on the RAG rating that's attached to that line, but does change the red dot to a green dot in Q3. So just for the record, just to get that updated. Chair, my colleagues and myself are more than happy to answer any questions on this report. Thank you.
Thank you very much, Alex. Thank you. And just a couple of comments from me. First of all, I really appreciate on the report we've got in front of us, seeing the trend line. It's a very useful way of seeing a sense of change over time, having that line on the report. So it's a helpful way for our own scrutiny of this report. So appreciate that comment. And obviously, it's really important to say thank you to all the staff involved in this and for the progress that's evidenced in many areas of the work of NHS Grampian as well. So thank you for that. With those introductory comments, I'll pass to Derek first of all, please. Derek.
Hi, thank you. We did ask for more information on the greens as well as the reds, and the one I'd like to highlight is the performance indicator on reduced backlog of unbooked TTG children's patients. Seemed to me to be very good performance there, and I think the whole point of this is to recognise, whilst we've got some poor performances, we've also got some really good performances. So just a wee well done to those involved in the children's hospital. Thank you.
Thank you very much, Derek. Really appreciate that as well. It's really important for us to recognise all the good work being done across NHS Grampian. So thank you for picking one out in particular. Hussein, please.
Thank you, Chair, and very good morning, everyone. I just wanted to give credit where it's due. I think that's important. This report has come an incredibly long way since the one that we last saw in 2023, and I particularly appreciated the spotlights because statistics tell a story, but the spotlights and the commentary from lead officers really help to bring that to light and allow us to visualize the state of play and what's going on around the different indicators. So congratulations and thank you for the incredible amount of work that's gone into that. And it really does help now to tell the story of where we've been and where we're going and how we're coming along. So I just wanted to put that on record, Chair. Thank you.
Thank you very much, Hussein. Thank you, much appreciated, I'm sure, by everybody. Thank you. Sandy, please.
Yeah, just to echo Hussein's point, I mean, I think there's been a tremendous step forward in relation to the quality of reporting and gives us far greater insight and assurance in relation to what's happening. The only comment I would make is I absolutely accept that for the board, I think it's really helpful to get a sense of the wider system and green, amber and red indicators in terms of how services are doing. we're about to enter an extremely challenging stage for NHS Grampian, as indeed all parts of the public sector in relation to huge pressures and financial constraint. Just to give assurance to the board that I think PAFIC will have a reasonably major role in looking at the red indicators in relation to where performance has not improved over quite a period of time, or indeed is slipping. The one thing, I suppose, just to give a heads up, that I want to kind of know a little bit more about at PAFIC, if at all possible. There's a wonderful example of waiting times for surgery in the Waiting Well initiative, which I think is excellent, and it gives a sense of how we're reaching out and supporting people who are waiting reasonably long periods of time for planned surgery. I would want to have that sort of discipline for some of the red indicators where performance has remained poor for quite some period of time. So, for example, psychological therapy. So in the narrative around mitigation, I would want to have some sort of commentary on what are we doing to support people meantime while they're waiting for services, and how are we, for example, working in partnership with our colleagues in health and social care partners to make sure these people are not left behind and some sort of support is given meantime until the right clinician can see them for services. So I think that for me, I think it felt like a contrast that we saw some really good waiting well and supporting people meantime, but there are some indicators perhaps where we could do with some explanation in terms of what we're doing meantime to support people. Thanks, Chair.
Thank you, Sandy. Adam's put his hand up. Do you want to come in to answer that?
Yeah, thank you very much, Chair. Sandy, that's a really helpful point, and we will work away at that to see what we do to support people during the performance that, again, we're all trying to improve but are slow. And I think the other contextual remark I'd make is in the financial plan and the annual delivery plan that we're bringing forward to the board in April, again, we'll be extremely transparent about what we anticipate happening over the coming period. So again, that will be something we'll really work through carefully with the board so that there's a real transparency and clearness, and that I suspect will require us to do more of the mitigation that you're describing in that period of flux over the next bit, whilst we absolutely concentrate hugely on the future, on that transformation that we need to make, not uniquely in Grampian, but across Scotland, around our health and care system at its broader bit. So that will be really helpful to work with PAFIC on that really closely, and then clearly with the whole board at the public meetings. Thank you.
Yeah, just before I bring Paul in, I think it's indicated to speak there. I think noticeable in that waiting well figure in particular was the comment about recognising that people need support sometimes need support with weight management, and for us to have the assurance that when patterns and trends like that are recognised, there is able to be that follow up, so that help that's recognised, and weight management was drawn out as a particular area of concern there. So thank you for that, Adam. I think Paul wants to come in on the same point.
Thank you, Chair. I think that's really important, and I think it's worth mentioning that the waiting well is both the physical health, but also helping to navigate and direct patients waiting for other services to help with finance, funding, loss of income when they're not able to work, particularly those with mechanical types of problems. And maybe just also mention very briefly, we've said credit due where credit due, and we've seemed to align credit to a performance number. I think it's worth just remembering that the number doesn't change until the backlog changes. And so when we look across our services, there's a tremendous amount of activity over and above planned resource time every day by clinical teams. And the actual activity levels are as high, if not higher, than 2019. And the internal efficiency is best in class for many, and never less than the upper third for most. So please find ourselves that credit and activity are often missed when we just look at the performance number, whether it's a 31-day or a 62-day figure. Thanks.
Thank you. I think Simon's coming in on this point as well. Then I'll come back to you for a follow-up, I think, Sandy. Simon. Sorry, you're on mute, Simon.
Thank you, Alison. Sorry. I think important for the board to recognise that the indicators that are in red in terms of people waiting and how people are waiting well, how much support is given through primary care and the impact that has on our primary care clinicians, in terms of the multidisciplinary team, GPs, practice nurses, HPs, etc. And we know that primary care is incredibly busy as well. So it was really just for, I guess, the board to kind of recognise that there is an impact somewhere else on the system and on our clinicians in other parts. Thank you.
Thank you, Simon, for that. Thank you. Sandy, would you like to come back?
Sorry, trying to unmute. I agree, Simon, that's absolutely right. And I think for our assurance purposes, I think that needs to be flagged up and recognised as part of the at least interim solution to what's happening, because we just need to know what's happening to those with lived experience behind those numbers. But I mean, I suppose just coming back to Adam's original report in relation to Chief Exec's report, though with the huge pressures on our system, there will be some things that are not within our gift or within our resources to deal with. And I think that is something where we maybe we need to consider whether things need to be referred on or escalated, because you gave some examples of some decisions being made out with NHS Grampian that will constrain or restrict what we can or cannot do in the short to medium term. And that has to be part of the discussion and the debate. If there are some things we simply can't do and we haven't been able to do for some time and it has got implications for the public, then we need to be able to escalate that elsewhere. And that's an important part of our assurance as a board that that's been done.
Thank you, Sandy. I think Adam's coming back to you on that one.
If that's okay, thank you, Alison. Apologies. Yeah, absolutely, Sandy. And I think building on your earlier point from the report about how Murray needs to work in a Grampian context, and of course, I absolutely agree with that. And that joined up bit at Murray, Aberdeenshire City and the Health Board and our wider partners with the councils and the community planning partners. We're also doing lots of work on a Scotland basis to try and work as a Scottish, unit, that sort of once for Scotland bit. So I was at national meetings yesterday and Tuesday, and there's a real, very, very sensible appetite to do that, so that we do the right things at a Scotland level, the right things at a Grampian level, and then the right things at a health and social care partnership level. So just absolutely agreeing with you, Sandy, that that's the really important bit of work for us to do. And that sense of, one of not just my key jobs, but one of my jobs, one of Alison's jobs, one of all the professional leads and everyone is working on these national groups as well to try and get that real sense of coherence across the country. So a really important bit of our work as well.
Thanks very much, Adam. Thank you. Thank you. John, please.
Thank you. And it's really on that overall theme in terms of assurance. Hussein mentioned how this is a step forward. I think it really is very significant. I can see for the first time some real connections and where we need to work across Population Health Committee into here. Anchor on page 27. We've got a report coming up tomorrow at the committee. And also page 39, where the 3 chief officers have brought in data. And there's probably, what I'm seeing in here, some very specific questions, which we can probably do offline as we see this, just to be clear, and then where we need to seek further assurance. So I do see in that one on access on page 39, being able to look at how, where there's a backlog of assessments due to delayed discharges and what impact that has on the flow, that we can start to dig into changes that we need to make across the system. So joining the dots is starting to come into focus here, I think. So well done to everybody. Thank you.
Yeah, and again, that's a really important point, John. Thank you about working across the system to get the best for patient care as that we can in health and social care across Grampian. So thank you for those comments. The committee that John referred to discussing some of these issues is the Population Health Committee, which meets tomorrow, which John chairs. Thank you for that, John. Ian, please.
Thanks, Alison. Excuse me. Thanks, Alison. Sorry. I've got one comment and one question. Comment, which others have, to be fair, covered, is that I like the format of the report and and it very clearly illustrates that the volume of the challenge, but also the amount of work and effort that's going into meeting and addressing the challenge. And I think that's important that we recognise as well, despite those major challenges. My question's perhaps not the most important question that will be asked today. It's on page 31. It's in relation to the uptake of new entrant apprenticeships. So it's about halfway down page 31, the first of the anchor points. Given the withdrawal of the funding from Skills Development Scotland, is the target of 12 now realistic, or should or is that now unachievable given the board's financial circumstances?
Thank you, Ian. That's a big question about working across the system as well, and other partners being influential in what we're doing. But Tom, please.
Yeah, thanks, Ian, for identifying this one. I think we've noted in the report that 75% of the 12 is a more realistic aim for us for the year and that it should be noted that that's for new entrant apprenticeships. That's a bit different from the apprenticeships that are on offer for colleagues already in NHS Grampian. So graduate apprenticeships is we're just recruiting some more of those as well. But yeah, clearly it's a challenging landscape, not just for us, but for a number of our partners. I was actually at a national conference of my professional body earlier this week, the Chartered Institute of Personnel and Development, and they have said that they're receiving lots of indications from employers across sectors about the concern at the withdrawal of funding for skills development support, from at a national level. So I think it's important to highlight that this is something that actually is a really important source of being able to create opportunities for people to enter and to employment and to develop careers as well. So we'll continue through various routes to try and lobby for some reconsideration of some of that. But in the meantime, I guess it does, I think we probably need to revise our target for the year down to 75%, so to 9 for the time being, and then we'll have to have a look at what's possible through the medium term plan when we know what the funding opportunities may be as alternatives to that Skills Development Scotland funding.
Thank you, Tom. And the fact that the emphasis is on that shows how we are continuing to look forward, plan for the workforce for the future as well, which is obviously an important part of the work that we're doing. So as NHS Grampian. So thank you for that, Tom. Just a question from me relating to the various spotlights we see, particularly the ones in green, because if looking across those, we see lots of examples of good practice highlighted. For example, in the one about children, highlighting looking at the importance of engaged and motivated teams and feedback evidencing progress being visible to people in the teams. And the one on access, it talks about work being undertaken to understand barriers to engagement and barriers to access as well. And obviously in that there's good points about how we can move forward and the kind of things looking at. They're presented to us in very much a portfolio by portfolio base. And my question is, how is good practice recognised and shared across the team? So when somebody comes across good practice and something gets good outcomes across the wider NHS Grampian and system partners as well, are we able to take that forward, recognise it and develop it in a different area? Don't know who that's a question for. Adam, maybe.
Thanks, Alison. I'm happy to start. So I think Geraldine's happy to come in. I'll perhaps ask June as well. Lots and lots of really good work through Magnet and things that maybe June could speak about. But I guess one of the challenges we have in a very large organisation of 17,000 people is how you do share and get things happening at scale. So it's definitely one of the things we share, and you'll see in various reports that we do how we work through professional bodies to try and share expertise. Through the quality improvement works, we then try to share things, but it's definitely a difficult thing. It's definitely a challenge, but maybe colleagues will give some examples. That would be really helpful. Thanks.
Thank you. Geraldine.
Yes, thanks. Happy to come in, perhaps just to share a little bit more about the children's theatre improvement work, where obviously that was mentioned. So I think in terms of the approach that was taken, there was some really good support by the planning, innovation and programmes team. And I think, you know, the way that it was set up was very much that whilst they were there to give us the tools, the service was really to own the project and to come up with some of the improvement and shape the improvement activity. And I think just taking that approach was really, really helpful. And what we found is that it's that real-time feedback that actually teams can see it and they can see the improvements themselves. And obviously that's really rewarding. And I suppose I would hope that given that that's, you know, that programme team can go in and support other areas, that they would take that approach and share that learning and feedback as well, because obviously that is, you know, really what we want to encourage as our overall approach. Thanks.
Thanks, Geraldine. Thank you. Susan?
Yeah, thanks very much. And I guess I won't say much about the quality team, because I'm sure June will come on to that. But yesterday at our portfolio executive leads, we were having a conversation about how we take the learning from the organisation, from our different portfolios, and look at how we might convert that into what we're terming actionable insights at that tactical strategic level. So I think at the moment we've got structures in place. We've got lots of examples of real-time feedback loops, but it's how do we scale that up? And certainly there was a real commitment yesterday working with colleagues in June and Nick's team about how we can align some of the governance improvements that are identified with some of the management tactical structures that we've got. So work in progress. I think it's a really helpful question and one that we are working our way through at the moment.
Thanks very much, Susan. That's very helpful too as an answer. Thank you. And June, please.
Thanks, Alison. And I think if we look at it from, we could look at it from a uni-professional perspective, we can look at it from a multi-disciplinary professional perspective. But when we consider nursing from Magnet is about ensuring that we've got clinical excellence. And, you know, if you been around Grampian long enough, you might have been to one of our Celebrating Excellence events. So we're really considering that quality improvement at that clinical level, because these are the individuals who, those clinicians, practitioners, are the people who actually understand what change needs to happen. And we give them the tools and empower them with things like the LEO programme, the Leading Empowering Organisations education, to support them to go in and do quality improvement in their own environments. And then that rolls out, and then it can then be scaled up into bigger examples of work and improvement. And then that then can be rolled out across other portfolios, other areas. And we use the Celebrating Excellence events as ways of showcasing that work for people then to engage and take network to their own areas. Thank you.
Thank you, June. They're really helpful answers. We've talked about the importance of working across the wider system with partners outside and with other health boards. And it's really good to hear that we're also working internally as well to spread good practice and share between ourselves as well. So thank you. Thank you for those comments. I can't see any other comments on the How Are We Doing report? No? Okay, well, thank you very much for everyone's contributions. We're asked to note this report, highlighting key areas of achievement and concern and the wider perspective through the spotlights. Take it, we've noted the report. Thank you. Thank you. Got nods there as well. Thank you. Okay, then moving on to item 7, the Baird Family Hospital and Anchor Centre project update. I will turn to June, please, for this. Thank you.
Thank you, Chair. So this has been awaited, and we promised that we would have an update to the board today. I also have Gary Kidd, who is the current project director, with me on the call, and Colin Adam, who is joining and will take on the role of the project director as of the beginning of next week. So I just want to take time at the board this morning just to acknowledge the extensive work that Gary has put into this project, of these two projects, and thank him for that. And Colin will be at the rails with Gary supporting him in the background as we move forward. So I just really wanted to say that to begin with. You will see from the report that you've got in front of you that extensive work has occurred. We are not entirely there yet. There's still work to be done in relation to understanding the feasibility of the solutions that have been put forward in relation to the design work, and that work continues. We also, the next step really around that is working with the contractor to get their support to take those forward. So you'll see generally that's been laid out for you within the paper. I'll just hand over to Gary and Colin to add in any detail they would like.
Thank you.
Yeah, thanks, June. There's not really a lot more to add to that. I mean, you'll see in the paper we've set out in section 3.1 the process that we've followed. There's obviously been a review of design ongoing for some time that culminated in a report to the project board on the 5th of March. The project board have considered, yes, the outcome of an HEI focused review of design, which you know we've updated the board previously. Part of that is about looking at learning from other projects and any recommended changes that come as a result of that. The project board also considered what the impact on programme of implementing any design changes would be, and the associated risks to patients and services that would arise from any further delay in occupancy. The project board also looked at a series of proposals which would involve appropriate risk management and mitigation measures, which would allow us to manage some of the risks highlighted as part of that process, and agreed a series of recommendations in principle. Some of those recommendations are bits of work that can actually proceed now to make some physical changes in some of the configuration of some of the areas in the buildings, and one or two changes in areas like the water system. Other of the actions agreed are to do a bit more feasibility work so that we fully understand the capacity that we have within the existing designed air handling plant, and in areas like sinks, so that we can fully understand the number of sinks that we can remove from the building without it impacting adversely on the rest of the water system within the building. So as June said, there's a little bit of further work to be done to fully understand the impact of the recommendations, and we hope to have that completed in the next couple of weeks and report back to the April board meeting on the potential impact on programme and cost associated with these actions that have now been agreed. In section 3.2 of the report, we've also given you a bit of an understanding of the various bits of information that were available to the project board and the consideration that's taken place within the project board. And in section 3.3, we've detailed, provided a bit more detail on the actual changes and bits of additional feasibility work that we've instructed. So in summary, that's where we're at.
Brilliant, thank you. Gary, did Colin want to add anything?
No, thank you. I just would like to introduce myself to the board, having joined NHS Grampian on secondment from NHS Lothian, and I do look forward to working with all of you.
Thank you, and thank you very much for that, Colin, and you're very welcome to be with us and share with us as well. Thank you. John, please.
Yeah, thank you very much for the update, and look forward to the April meeting where that comes through. Can I take us to the top of page 48? And you described there was the risk between the further delays and the impact on patients for that, and then this highlights the lack of consensus in the board and the risk around that. It kind of alludes to that's possibly around infection control, but I'm not sure if it's explicitly that. because this board itself will be taking on the risk from the project board as well. I just want to be very clear about that particular aspect and the balancing of the risk that's taking place, please. Thank you.
Thank you. The paper's referring to the project board, I think, isn't it?
Yes, it is.
Two boards.
Except we, what I mean is that we
Yeah.
as a board have our own
Yes.
accountability for this.
That's right. But the comments about the project board in the paper. Thank you. Thank you. June, do you want to comment?
Thank you. Happy to do so. So, John, yes, the project board, when we haven't met consensus with the team, so the technical experts who've been working through it and haven't met consensus in relation to a solution, that will then come to the project board that has many executives around it to make a decision around about what's the best way forward. That will be done in line with NHS Scotland Assure. And with support from our Scottish Government colleagues as well. So that whole process is worked together. And so it's not done in isolation, if you like, by the project board. So the areas where we don't have consensus yet, we can still working through to see if we can find a suitable solution so that consensus can be sought. If not, we'll go through that process. Those then, whatever the decision is and what that solution is, will be managed. So if there is risk associated with that, that risk will be managed by the way that the hospital is operated, or there's other ways of mitigating, and that will be clearly laid out, and we'll understand that risk. There's no system, no hospital entirely safe. We always will live with some risk that we have to manage and mitigate and clearly maintain as we move forward. I hope that answers your question. And let Gary come in as well.
What? So Nick was, before I bring John back, Nick put his hand up, I think, to answer that as well. So turn to Nick first, and Adam, and then back to John. Thank you, Nick.
Yeah. I was just going to build on June's answer, because I had the pleasure of chairing the 5th of March project board meeting. And I think the thing for the board here to be clear on is that all of the actions described out, set out with Gary, were reached as a consensus way forward for the next steps. So all of these next steps we do have consensus agreement on. That doesn't mean there aren't expert opinions to give one bit of advice or another bit of advice, but the next steps are going forward in an agreed fashion. And again, June alluded to Scottish Government, so Scottish Government representatives were present at that meeting and also concurred their ongoing support with that process. So I think those are two really important things. Is June's absolutely right. There's a process. If we get to, if you like, a place where there isn't a settled consensus opinion, but the steps forward at the moment are sitting within that frame just now. I hope that's okay to build on that, June, in that way.
Yeah, Nick, that was helpful. Thank you. But bring Alan in next. Alan Wilson, please.
Yeah, just to reiterate to John in regards to the board and the board taking on risk going forward, NHS Assure need to have a supported status on any project going forward. So that means when we get to that supported status, it means that the design that we've done is a safe environment for us treating our patients, because that was the whole point of them being set up. If any risk, any project's got a risk, any engineering system will have a risk. Humans is the biggest risk to any systems, how we operate and utilise it. And I hope the board will see that we're looking at mitigations for any of that which has come up previously. So it's just to say that, that is the process, so that we wouldn't be going any further forward without the support of NHS Assure, because we wouldn't be able to.
Thanks very much, Alan. That's helpful. John, can I come back to you?
Yeah, no, that's really helpful. I think it's important for us to transparently see this as a board, and so that we can support what comes through. So I'm assured by the process there, the executives around this supporting the board, the executives like Nick chairing that, and it being consensus, and then the national input to it. And yeah, it's incredibly complex, this project, but I just really wanted it to be transparent for us, and then we can give our support to what's coming through from this. Thank you.
Thank you, John. That's really helpful. Thank you. Derek, please.
Thank you. I was really heartened by the way I was reading this report, which is that most of the issues have now found a way forward. And the way I was reading it, NHS Assure were in agreement with what was being proposed. My question is, with all of these agreements now in place to take forward, do we have the funding to do it?
Thank you. June, you're responding to that, I think.
Yeah, thank you, Derek, and I'm glad you're definitely seeing the progress within the paper. What I can say is Scottish Government continue to work with us and support us in what we need to do and to move this project forward. Thank you.
Thank you. Thank you very much for that, June. Thank you. Mark, please.
Yeah, thanks very much. I think I was also very pleased to see some really good progress made on the last meeting that we had, and with this paper. I think we are working through the issues. I especially like the 4.0 key stage assurance reviews. I think is really, really important. I think working through that, heading towards, I think you've put June 2024. It'd be really interesting to see exactly where we've got to at that stage. But it really does look like there's some excellent progress being made through the risks that were identified, and with some pragmatic solutions to those, I think. So yeah, I think it's a very good progress. Thank you.
Thank you very much, Mark. Thank you for that. And thanks to everyone who's contributed to answering those questions. I can't see any other indications to speak on this. No, so we're asked on this to note the progress of the Baird Family Hospital and Anchor Centre project. So I take it we have noted it. Nods on that one, please. Thank you. So we've noted that report. And that leads us to a comfort. We're ahead of time today, very unusually, but we're ahead of time. So we will take our comfort break now in case we've other people joining us for the later agenda items. So we have a 10-minute comfort break. So if we come back at 6 minutes past 11, please. Thank you. Thank you very much. I trust that everybody's back now. Thank you. Okay, so we'll move on with the agenda now. Item 8 is the strategic plan for Dr. Gray's Hospital, and I'm turned to Simon Booker-Ingram to take us through this, please. Thank you, Simon.
Thank you, Alison. I'm also joined by Christina Cameron, Programme Manager, who will come in straight after me, if that's okay. And Alistair Patson, who's the Dr. Gray's Hospital General Manager, will also be joining us as soon as he gets out of his other meeting early. So I think what you've got in front of you in terms of the update paper is some really good tangible progress on the strategy implementation. So we can see some things definitely kind of moving that are real and physical. I think there's a real strength in having those links to the work on the maternity model. I think that strength is that both pieces of work are happening together, and it does scale up that implementation towards achieving our strategic aims for Dr. Gray's in a way that creates an efficiency and effect with the level of resource that we have got around this. So I'm going to ask Christina, if that's okay, Christina, just to come in for no more than kind of 2 minutes, just to give some highlights and lowlights. Thanks, Christina.
Thank you, Simon. Thank you, Chair. I will speak quickly and try and give just a very key summary. So the paper, as Simon says, provides an update on some of the implementation work that we've taken to date to deliver against those strategic objectives, and also highlights the impacts of some of our current challenges that are well known and what plans we have and have put in place to manage those challenges. So the paper sets out a wee bit of a reminder at the beginning of our vision for Dr. Gray's and some of those strategic objectives under people, place and pathways, and also a reminder of the energy that exists locally in Moray, both in the staff and in the public engagement, which is ongoing. So a few highlights on the progress that Simon mentioned. As ever, our programme approach has allowed us to create some improvement in structure there, and we have brought together and formed a group of senior clinical leadership roles there, and we have another one of those group meetings at the end of this month. That will be followed up by a series of collaborative workshops with staff, which will help us to describe and design the service structures and models that will be needed in each service to deliver those strategic objectives. And as Simon mentioned, we also have strong and supportive links with colleagues in the maternity programme, which have proven to be really helpful, hopefully in both directions. So in support of workforce, we have known for a while that access to accommodation locally was a challenge and a negative driver for our success in securing the right staff and the right skill sets for the hospital. So we have subsequently secured and developed 5 units of accommodation, 5 flats, one of which was taken up recently by a newly appointed consultant with very positive feedback, which was great to hear. We have also worked with Aberdeen University and Moray Council to establish an accurate and evidence-based understanding of the current picture of accommodation locally and what for NHS Grampian and Moray represents our demand and our capacity, our ability to meet that demand for staff and student accommodation. We have produced a position statement that sets out that, so hopefully provides a bit of clarity for all of the stakeholders around those issues. We have, again in conjunction with Aberdeen University, developed a dedicated clinical skills centre. Training was a key area of feedback in our staff engagement, and we have developed that in order to support dedicated training sites, simulation and clinical practice for staff. So that will link very closely to similar function and facilities in Aberdeen as well. We have, of course, completed and now shared a space quality and functionality report which addresses the hospital's infrastructure, the areas of priority, and we have further then developed a local development framework which takes a much longer term look at the area, and that will be launched next month. We have also undertaken a detailed review of demand, capacity, activity and queue in our theatres function in Dr. Gray's Hospital, which we realised early was a priority area and is also a key element of the clinical infrastructure for the hospital, and again links back closely to our maternity service ambitions. We are developing, based on that data which is being shared with staff, a theatre sustainability plan which will include local improvement works to address performance too. We have met and continue to meet our commitment to ongoing engagement. We said that when we started that engagement wouldn't be a one-off exercise, it would be an ongoing activity. So we have held to that, including staff feedback, which you will see on screens throughout Dr. Gray's Hospital if you spend any time there. We have strengthened our engagement with local stakeholders, other organisations, and our role as an anchor organisation there as part of the Moray Anchor Network, and we have hosted a stakeholder event with that network on housing and childcare and how these challenges impact on workforce supply for us and for other stakeholders in the area. And our next public engagement event is a drop-in session in Elgin High Street on Saturday, 20th of April. In addressing the financial challenges as it relates to the Dr. Gray strategy, we have taken some time to refocus our agreed implementation approach and now plan to focus and prioritise our efforts on 3 key areas of redesign, which we believe will help us achieve the vision that we have agreed for Dr. Gray's and enables it to focus on doing what it can do and do it well. And those 3 areas, as outlined in the paper, are focusing on redesign for the front door, for theatres and for the surgical menu of activity. So we believe that with these 3 areas, the priorities for 24-25 going forward, we can achieve improvements in affordability and sustainability for the hospital as an operational site, but also deliver and hold true to the strategic vision which has been agreed by the board. I'll stop there if that's okay. Thank you, Simon. Thank you, Chair.
Thank you, both Simon and Christina, for that. Along with Adam, I attended the Moray Anchor Network event the other week on childcare and on housing, and it was really good to see in practice the teamwork across the area and people coming together in a solution-focused way as well. So it's a really important way forward, I think. So thank you for the ongoing work, and thank you for that emphasis as well. Tom, please.
Yeah, thanks, Alison, and thank you, Christina, for the update. I just wanted to check on the issue of accommodation, that the position statement, and I guess the focus there includes existing accommodation that we haven't provided for trainees and students, because I think that certainly has been raised with me as an area of concern and that would benefit from attention. And it'd be good to be able to feedback that that is the case if, you know, that it's in the line of sight.
Christina? Are you?
Yeah, happy to answer that. Yes, it does. So when undertaking the strategy work around workforce and some of the drivers that allowed us to recruit and bring the right skills and some of those that were challenges, you will have heard anecdotally accommodation comes up regularly as an issue. So given that there was a wealth of anecdotal evidence, but not necessarily a very clear picture that was data driven. That's why as a strategy programme we undertook the exercise of assessing the situation to provide a clear position on where we are. It does take into account, and Aberdeen University helped us to understand the needs around student accommodation. So it takes that into position and goes to the level of a detail of setting up a table of different types of accommodation for which different types of staff, and the amounts that we need and the size. So is it one bed, is it family accommodation? So we have a very clear understanding now of what that picture is, and happy to share that.
Thank you, Christina. Thank you. Tom's nodding there. Thank you. Derek, please.
Thanks, Alison. I just wanted to express a little bit of disappointment about the National Treatment Centre being stopped. The National Treatment Centre for us included an MRI scanner at Dr. Gray's. Now, that scanner, not only important for Murray, but it's important for the whole of Grampian. But alongside it, there's necessary Ward 4 of Dr. Gray's, and these two go together. So not only is the scanner stopped, the Ward 4 works are also stopped. And I wondered if there was any way of going back to the Scottish Government and extracting the MRI scanner from the National Treatment Centre works at Aberdeen and seeing if we could persuade them that there was something that we could do at Dr. Gray's at a proportion of the cost of the full National Treatment Centre at Aberdeen.
Thank you, Derek. Simon's indicated to answer that one, please, Simon.
Thanks, Alison, and others may want to come in as well on this. So Scottish Government were very, very aware, fully briefed on the connection between the two pieces of work, so Ward 4 and the MRI scanner, and I suppose the level of disruption that would occur and the contingency plans we'd need to make for those inpatient services on Ward 4 to get both pieces of work done. So I think, you know, the reality is we're in the financial situation we are as a country. We've had the direction around what is paused and what can continue. That's not to say we don't stop our discussions and dialogue with Scottish Government, but at this point we don't have the funding to move forward with either. Now, for the Ward 4 piece, that work, that proposed works in terms of the anti-ligature work, that proposal and those costs are going through our internal capital asset management group, which I understand meets again in a few weeks, and will look at all of the needs that we have across the Grampian estate, but recognising that we have very limited capital, and so decisions will need to be made about prioritisation. But yes, in answer to your question, Derek, you know, those discussions with Scottish Government continue, but the direction has been clear. We were working very closely with them in the run-up to that national announcement on the unavailability of capital.
Thanks, Simon. Adam wants to come in as well.
Yeah, thanks. Just to add a tiny bit to what Simon's saying, my recollection, Derek, is that the MRI and Ward 4 were only realistic in the government perspective by bundling them with the National Treatment Centre, is my recollection. So on their own, I don't think they would have risen up the list. So that was the agreement and tactical approach with government to do that. So, but we can absolutely look at, as you say, divorcing them and seeing if that comes. But as Simon says, I think the national funding is very unlikely to come forward in this bit. And just a wider bit of context that we could pick up with the board at another point, Paul's been leading a really good bit of work about our overall approach to MRI scanning across the whole estate and how we work going forward to get that demand and capacity better met. So that's maybe something Paul could share with us at a future event, just to help explain what we're trying to do over the coming period of time. Thanks.
Before I bring Derek back, I'll turn to Paul to maybe expand on that. Thank you.
Yeah, no, I think that's a really important question, Derek, and Adam's right. We've got a lot of work being done to look at our sort of capacity, demand, failure around MRI across NHS Grampian, and there is no doubt we need additional capacity. But I think this allows us the opportunity just to have a rethink of what we need and what type of MRI scanners we need. Earlier on we spoke about the Baird Family Hospital. There's also a very strong case to be made for an MRI scanner going into that facility to make it future-proof. So there's something around the technology that we need in addition for diagnostics now, for backlog and maintaining, but also what kind of MRI scanners do we need in the future, and where do we need them? So I think I would suggest that we use this as the pause to review, and it may well be that we need MRI scanners and it be in Murray and maybe not in a hospital setting, although that was the best preferred option previously. So there's lots of things I think that are up and coming and need thinking through as we go through. But as Adam has said, a future sort of event may be a good place to review all of this. So thank you.
Yeah, that sounds really helpful. Thank you, Paul. There's obviously a lot of issues to consider within all that. Thank you. Derek.
Yes, thanks. Interesting to hear that we are reviewing the MRI scanner situation. One of the reasons for having it up in Murray was to make it easier for people in the Murray area and North Aberdeenshire to get to an MRI rather than having to come through to Aberdeen. And that will always remain. So presumably that'll be factored into your review. But the other thing that Simon mentioned was perhaps affording to do Ward 4 out of our own capital. My understanding is, and Simon, you can put me right here, my understanding is if we do that, when we do Ward 4, and then come to do an MRI scanner back on the Dr. Gray's site, we have to decant Ward 4 a second time. And that needs to be taken into account. Even if we had money to be able to afford Ward 4 ourselves, needs to be taken into account. Do we really want to go through a process of decant twice? Thank you.
Yeah, thank you. It's obviously getting into how things would happen on the operational side of things. But just Simon, do you want to answer briefly on that?
Yeah, Derek's absolutely right. The level of assessed noise and disruption and the impact on patients in Ward 4 would mean that if we did the anti-ligature work on Ward 4 and then at a later stage had the money available and we had made a decision that was still the best place, then to put an MRI scanner in exactly that location that was originally intended and planned would necessitate the decanting of Ward 4.
Thank you. So it shows that there's just an awful lot of issues to consider moving forward, and so that discussion at a later date that Adam and Paul mentioned sounds important. So thank you for that. John.
Thank you, Alison. I wanted to wait until others, because I'm quite a distance from the project, but maybe it has a perspective that is helpful in one way. Clearly, with the £12 million gap, there's a need to attend to that, but hold true to the project. So just as a comment, what I'm seeing in the report does do that, I think, and I would commend those involved in it in trying to achieve that in quite a difficult situation. and it does seem as if it's going to help that bit about Murray to flourish and that element. What I was curious about, which is my question, was just in terms of its part in the wider system, and this is partly where we entered this as a board and the need for the 10-year strategy. And there is reference in the report to kind of single practitioners and that having some fragility. Just wondering if there's any further comment any of the executives can offer us just in terms of progress in knitting Dr. Gray's into the wider health system. That would be helpful. Thanks.
Thank you, John. I'm looking to see who would like to answer that. Adam.
Yeah, I'm really happy to start. Or maybe if Simon starts, and then I'll add anything that I think builds on Simon's.
Okay, thank you, Simon.
Thanks, Alison. Thanks, Adam. I was going to suggest if Alistair's made it onto the call, he might want to come in on that. He's probably best placed to say where we're at on that.
There he is. Alistair's just appeared at that moment. Alistair, thank you for joining us this morning. Sorry we're running a bit early today. Thank you.
No, not at all. I have managed to catch most of the discussion, but just popped my camera on just now. So yes, I think there's lots going on, John, in relation to trying to connect Dr. Gray's to different parts of the system. We're actively engaging it, certainly at an operational level, where we do have those kind of single-handed points of failure, if you like, in some respects, just in terms of sustainability and reliability. So that kind of associates or links to specific pathways, specific specialties, and there are active conversations going on around, for example, cardiology, gastroenterology and endoscopy, and indeed diabetes. And we've made some really good progress on the diabetes side of things, first joining the teams up between Murray and Aberdeen-based teams to build that kind of workforce plan that allows staff to move between sites and create much more resilience and much more parity and much better governance, if you like, between the two arrangements, which was a real important point. So lots going internally within Grampian, but out with Grampian, some really continuous active links with colleagues across in Rigmore and NHS Highland, which was always part of the ambition, if you like, identified through the themes that we picked up as we developed the strategy to kind of build that kind of regional networked model. So I'm in active conversations at the moment with colleagues in Rigmore, as is Duff Bruce, our clinical lead, meeting with colleagues across there and really trying to build on some of the experience that we've taken through the maternity work to date in terms of building those relationships and connections and seeking out opportunities to develop that kind of resilient, sustainable piece that addresses not only the affordability bit, but the sustainable clinical pathway piece as well. So there's lots going on there, and I think as we get into the next phase of the strategy that Christina's described, specifically around theatres and specifically around that unscheduled care piece, I think we'll continue to do that and continue to be able to perhaps describe that better to yourself and other board members as those programmes of work start to develop.
Thank you very much, Alistair. Adam, do you want to come in? Thank you.
Yeah, just to absolutely build on Alistair's bit around the network with Highland. I'm sure colleagues are aware that Pam Dudek is retiring imminently, and the new chief executive is someone called Fiona Davis, who I spent quite a lot of time with yesterday at the national meeting, and we were talking about the value of networks between Grampian and Highland for sustainability for both teams. You know, it's really important for this the Murray part to look both into Highland as well as to Aberdeen. So it was just to add that, and Fiona's equally committed as Pam was. So, you know, really positive indications that will continue to we will be able to continue to build on the very good start that Alistair set out. Thanks.
Thank you. And Geraldine, you come in on this as well?
Yes, thanks. It was really just to mention some of the work underway on the maternity collaborative as well, which closely links into the Dr. Gray's strategy. So we have obviously a ongoing recruitment campaign, and we've had quite a lot of success with that in terms of some recent appointments in paediatrics and in obs and gynae, and some leadership midwifery roles as well. And I think, just as Adam's described, we've been doing some joint workforce planning also with our Highland colleagues. And I think, again, it's that different approach which is really setting things up quite well. Thanks.
Thank you, Geraldine. John, the comments give you assurance about progress here?
They do, thank you. And I think, as Alistair's saying, if that's described as the fruits of it come through in the future updates, that would be very helpful. So thank you very much for that.
Yeah, thank you. Certainly looking forward to future updates on Dr. Gray's as well. Thank you very much. I can't see any other comments in this paper. No, thank you. So we're asked to take assurance, noting the earlier successes and reported progress to date, and endorse the recentering of the programme to include significant service redesign that sustainably delivers the strategic intent and supports the people of Murray. And they were the 3 key areas that Christina outlined to us when she was presenting. Can we agree those recommendations, please? Thank you. Thank you for that. Moving on then to item 9, the Blueprint for Good Governance Action Plan. I turn to Tom, please, to introduce this.
Yeah, thank you very much, Alison. Board members will hopefully remember that the board was appraised in August 2023 of the requirement for us to undertake a self-assessment in respect of version 2 of the Blueprint for Good Governance for NHS Scotland. And at that time, we also covered off how this aligned to our existing and ongoing work around developing the culture of the board, and would also help to inform, I guess, future board development work across a sort of broader frame of reference as well. So having completed the self-assessment in October, November, we were provided with the results by NHS Education for Scotland on behalf of the Scottish Government in December. We considered these results as part of a board seminar in January that was facilitated in accordance with the parameters for working with the Blueprint for Good Governance self-assessment by Jason Nichol as our board's organisational development lead, and also by the outgoing board secretary, Sarah Duncan. The seminar considered the results and the possible actions in relation to those in the context of our exploring the implications of complexity, change and uncertainty, and what those mean really for the seeking and provision of assurance at a board level. So the action plan, which is contained in the appendix to the paper, requires to be submitted to Scottish Government by the 1st of April. And so today we're seeking the board's endorsement of the action plan. And it has 3 strands to it. Firstly, ensuring that the board will focus, sufficiently our attention, our capacity on transformation, innovation, and managing and addressing risk. That we undertake further work on developing the culture of the board, culture really that supports appropriate and wide participation from all colleagues on the board, and also finally how we triangulate and use different sources of data and evidence in the assurance process and in informing our work moving forward. So with the board's agreement today, we'll look to incorporate these actions into a programme of development work for the year to come. There aren't any specific timelines prescribed around when we should report on progress to Scottish Government. We looked at some of the materials around that and are making further inquiries about it, but we would expect that we would be looking at measuring our own progress against these actions once agreed on at least an annual basis. So that's all I really wanted to say, Alison, at this point in time. Happy to take any comments, questions, and hopefully colleagues will feel able to endorse the actions for submission to Scottish Government.
Thank you very much, Tom, and thank you to everyone who was involved in leading the development session, and also to all the board for the contributions made to the specific self-assessment and to the ongoing development work across the last year as well. So thank you. And I think we've reached a point now where we've got something that's proposed to go forward, and seeking endorsement and comment from people today on those 3 areas. So are there any comments or questions from anybody? June, please.
Thank you, Chair, and thank you, Tom, for the paper. My question was really, my reflections more are really in relation to the action plan, in particular the first action there. And I'm just wondering, in the context of where we are with the financial plan and the ADP as we move forward, have we got this just quite right, or is there something more that we need to have in there in relation to how we're setting that direction holding to account element?
You mean
that's my question.
Yeah, to relate to the ADP more. Tom, do you want to comment on that first of all, and then other people maybe?
Yeah, I think it's probably about striking the right balance, isn't it, between what we know needs to be done in order to achieve sustainability in the long term, and maintaining a focus on that whilst acknowledging the challenges of the current environment to doing that. You know, I think that was probably the intent behind that action. If we need to do any tweaking to the wording to make it clearer, then I'm sure we can do that. But I think it was very much seen as a both and, rather than we'll replace a focus on the here and now with just more of a focus on transformation. I think the two are inexorably linked, aren't they? But it's a reasonable point to highlight, June. Thanks.
Thank you. Are there any other comments related to that or to anything else? Adam.
Thanks, Alison. Thanks, Alison. Yeah, and I wonder if that's if it's worth maybe just a sentence that highlights June's point, so that we get the balance really explicitly in it. I think that's I thought the plan was excellent, and as June says that, it absolutely gets me thinking about just getting that focus between the two bits, so that we find the right balance of that in terms of how we work as a whole board, and whether that's worth just I think it's only a sentence in there almost, but it just highlights that importance between the two elements of being forward looking and the undoubtedly huge challenge we'll have over the coming period of time. And I think it relates really nicely to the sort of comments we had earlier relating to how we're doing, what PAFIC's role will be, and I just wonder if that would be a helpful thing to be just slightly more explicit in there. So it's not a change. I think it's a both and, as Tom said. It's just that addition.
Yeah, I was waiting to see if anyone else had any comments, but it's something around acknowledging the context, I think, is what we're looking for here. Just a brief phrase like that to add to it, to clarify that. Obviously, we can finalise words later if people agree, but have people agreed to add something to that effect in that first action point? Can't see anyone disagree. So if you disagree, let me know now. Okay, so we're asked in this to endorse the action plan for submission to the Scottish Government. Can we agree that the people who are involved in the development so far, the two people that lead on that, that's myself and Tom and Jason and John, finalise the wording? And with that finalised wording, incorporating the view of June there, we then endorse the action plan for submission to the Scottish Government and agree that a board development plan should be developed to support the action in the areas, and then the update in 12 months. Mm-hmm. Or are there any other changes that we need as well? No other changes? Okay, so can we agree those 3 points with the development team finalising the wording?
Agreed.
Yeah. Okay, thank you very much. Thank you very much for that. And thank you for your suggestion, June. And again, thank you to everybody who's put work into doing this. So we will finalise that, and then we will send it to the Scottish Government by the deadline of the 1st of April. Thank you very much for that. So that's the recommendations on that, with that slight tweak agreed. Thank you very much. Moving on then to item 10, the Forum and Integration Joint Board reports. First of all, we have 10.1, the Area Clinical Forum. Mark, would you like to introduce that paper, please?
Thanks very much, Chair. Obviously, the paper is in front of you, and it's a report from our last meetings. The only things I suppose I would bring up were we've had quite a lot of engagement now with the annual delivery plan and how that's linked with the financial plan. Obviously, that's got some implications from a clinical point of view that we're trying to work with the ACF, and I think it's been excellent that we've had the engagement with regards to that. So that was very supportive. We looked at staff breaks and rest and recovery, and obviously you saw in some of the How Are We Doing report that junior doctors not taking breaks was something that was highlighted as being an issue, and we've been working quite actively with our partnership with that and making some pretty good progress, I think, on that. So that will be coming out hopefully in the next few months to get some direction on that. So that's been very engaging. The biggest bit, I suppose, is what the long-term future for healthcare delivery is going to look like, and that's obviously a huge piece of work. And I think that we're going to be working with Stephen Lindsay and with Susan Webbs as a part of a co-chaired group looking at how we're going to give some direction to services on how we're going to develop that forward. So that's a good bit of work. It's in its infancy just now, but we have a further meeting today to start consolidating a commission for that. So that's progressing really quite nicely. And I suppose the other aspect that I was going to touch on, I was very pleased to hear Adam reflecting this in his Ask Adam comments just recently, would be around the culture, about how much good work that actually goes on in our clinical services. I think it's very easy to get bogged down in the financial problems that we have or the constraints that we have, but we forget about all of the good bits that we progress through, and how many good clinicians are out there seeing patients and really influencing the healthcare across NHS Grampian. So I really want to emphasise that aspect. But other than that, the paper's there, and I'm happy to take any questions on it. Thanks.
Thank you, Mark, and thank you for the work you're doing as well to coordinate and lead as well. Thank you very much. Any questions or comments for Mark, please? Anne, thank you.
Thank you, Mark. It's about your staff breaks, rest and recovery. I totally agree with that part, that it's very important that staff do it. At a recent visit I had to ED, one of the suggestions there was that, especially in ED, that they have a tea trolley that goes round at certain times, that people could actually maybe not stop and have a break, but at least they would have something to eat. It sounds a very maybe silly thing, but it actually could be really useful, because at least the staff would have something to, a cup of tea and something to eat at regular times. So that was one of the suggestions that came from the ED department.
Thank you, Anne, for highlighting that. And yeah, the rest and recovery is a really important piece of work that I know Mark and but Stephen as well are both engaged with. So thank you very much. With that, can we note the report? Thank you. Thank you. And we'll turn to Stephen, the Grampian Area Partnership Forum, and he might bring up that point as well, which is why I've kind of segued into Stephen. Thank you.
Thank you, Chair. Yes, while I haven't actually included in this GAPF report any mention of the staff breaks, rest and recovery piece, that's obviously an ongoing bit of joint working between colleagues in GAPF and the Area Clinical Forum. So, as Mark has indicated, hopefully we'll have something some tangible outputs that we can share across the system and really try and improve the situation within the organisation on that. In terms of the GAPF report itself, I guess I'm encouraged that the topics that we've covered earlier in this board meeting have been things that GAPF have absolutely been cited on, I've been able to discuss, I've been able to input on. So that's everything from the incredibly difficult financial challenges, but also all the safe transfer of care work that that took place when it was introduced just before the festive period. So while partnership working, positive employee relations continues to be very much prioritised within the organisation, and particularly even when at times not all colleagues agree with a particular course of action, we're able to discuss and air those disagreements in an agreeable manner. So along with that, continue. I'll stop there and invite any comments or questions. Thank you, Chair.
Thank you. Any comments or questions about GAPF papers, please? No. Well, thank you, Stephen, for the report, and thank you for presenting as well today. Can we note the GAPF paper then, please? Thank you. Okay, then at 10.3 is the integration joint boards papers for the chief officers. The chief officer I can see is Simon.
Happy to kick that off, Alison.
Thank you.
Thanks. So I think the summary
shows the continued breadth and depth of business that the IJBs are covering. Whilst there are some similarities between between two or three of the IJBs, I think the summary demonstrates that the IJB is responding to local need and local issues and pressures. Of course, the focus has been on finance as well over a number of months, but I think again this report hopefully gives assurance that the IJBs are not taking their eye off the ball and just focusing on money, that the rest of the business continues to be taken care of. Thank you, Alison.
Thank you very much, Simon. Any questions or comments, please? Now, I have one, Simon. I have one relating to the paper that we've got included there and the comments about the Murray IJB meeting in September 23. It talks about the NHS Grampian delivery plan being presented to the Murray IJB and consideration given to the compatibility with the Murray IJB strategic aims and objectives. I didn't see a similar thing in the other two IJB reports. I just wanted feedback on what the outcomes of that session and how valuable it was felt to be when that paper was discussed at Murray. Thank you.
Thanks, Alison. So I think it was incredibly valuable in terms of us thinking about how we coexist with the rest of the health and care system across Grampian, and how we interplay with not only NHS Grampian but our other two IJBs as well. So I think we've highlighted that from our summary report from a Murray perspective, but I'm very aware that Aberdeenshire and Aberdeen City have also done similar exercises and are looking at, within their meetings and outside of the meetings as kind of officers, looking at the fit with the strategic direction of travel. And I think you know that the bit that I can give assurance on is that we've all taken on board the NHS Grampian strategy in terms of people, place, pathways, and have very much, I think, aligned how we're positioning our own strategic plans for IJBs in that way. We have done the exercise of looking across at the three IJB strategic plans, and of course they're incredibly similar and fit with the NHS Grampian strategy. So whilst they're taken from a local perspective and the presentation is very kind of local to each of the three IJBs, there is I think a really strong fit with what we're doing across the piece. And then the forums and meetings that we have, the construct of the North East Alliance and the Population Health Alliance, etc., I think continue to bring all the partners, in not just IJBs and NHS Grampian, but local authorities, police, fire, etc., into that arena of all pointing in the same direction.
Right, that's really helpful, Simon. So yeah, that obviously the discussions are then happening across the piece. It's just what you've chosen to highlight in the paper. So yeah, that's very helpful. Thank you for that clarification about that partnership work. Because again, it's been a theme of this meeting about how important that is. So thank you. Any other questions or comments about the IJB integration joint board papers, please? No, so we can note, I hope, the integration joint board paper. Thank you. And then move to item 11, the approved committee forum and IJB minutes, again for noting. So I'll just go through these and please indicate if you'd like to bring anything up at any of these papers. First of all, 11.1 first of all, the Audit and Risk Committee of the 24th of October. Can we note that paper? Then 11.2, the Performance Assurance Finance Infrastructure Committee of the 14th of November 23. Can we note that paper, please? Thank you. And then 11.3, the Staff Governance Committee, 24th of October 23, and Staff Governance of the 19th of December 23. Can we note those, please? Thank you. 11.4, the Clinical Governance Committee, 21st of November 23. We note that, please. Thank you. 11.5, the Grampian Charities Committee of the 24th of November 23. Can we note that, please? Thank you. And the 11.6, the Population Health Committee of the 6th of October 23. Can we note that, please? Thank you. Okay, and then moving on to the forum reports, we have 11.7, the area clinical forum, the 1st of November, 1st of November 23. Note that one, please. And the Grampian Area Partnership Forum, the two there, the 16th of November and the 21st of December. Can we note those, please? Thank you. And then integration joint boards themselves, 11.9, the Aberdeen City IJB. Thank you. 11.10, the Aberdeen Shire IJB, two there, the 11th of October and the 6th of December. And then 11.11, the Murray IJB, again two, the 28th of September and the 30th of November. Can we note all those, please? Okay, thank you. Also, all those papers are noted. Very much appreciate your engagement with those. Thank you. Item 12 is any other business. I did omit at the beginning to say any matters arising from last month's minutes that we haven't discussed anywhere else in this agenda today. So was there anything from matters arising from those minutes that we should have discussed earlier? No, thank you. Thank you. Okay, any other business? No, thank you then. Well, thank you very much to everybody for contributions today. Date of our next meeting is Thursday, the 11th of April. So I look forward to seeing everybody there at that meeting. Thank you again, everyone who's attended and listened in to our discussions and deliberations today as well. Very much welcome your engagement with the work of NHS Grampian. And I say, close this meeting now and look forward to meeting the board members at 1:15. Thank you. Thank you very much for that.